Hello, everyone. Welcome to this latest episode of the Healthcare Innovation Podcast series by Health Hack Insights. Today, we have with us Akansh Khurana, who is the founder and CEO of THP, one of the largest real-world evidence companies in India. There's a lot of interesting things to talk about with Akansh. One about his entrepreneurship journey, the second about healthcare innovation, and third also about data, because there are very few players who play in the data segment in healthcare, especially in a country like India. So Akansh, welcome.
Well, thank you, Pura, for having me over. And I think there's a lot to take inspiration from you of running a healthcare analytics company as well. And we look forward to this dialogue.
Thank you. So Akansh, maybe if you can start with an introduction, your background, how you got into this space, and then we'll talk about THP in more detail.
Yeah, no, absolutely. I think in general, a lot of us, we have this, broad sort of myth, right? That suddenly something happened and there's a trigger point when people sort of get into entrepreneurship. I don't necessarily think, it was that in our case and specifically in my case, right? I had a great career. I was very comfortable. I knew I'll become a partner in the company that I was working in eventually. And, uh, and I think, I started looking at the ecosystem outside. I think the market was the whole entrepreneurship was very sort of early in the phases back then. This is that time window of 2013, 14, 15, when some great startups had started to sort of emerge. And I thought that there's really some good action happening out there. Right? Let's just sort of explore what's outside the comfortable cushion roles and jobs that we're all in. And I was sort of classic middle class, right? I was, when some people had already taken risk, raised a lot of money, become successful, I kind of followed the herd and I said, let's just explore something exciting out there. Healthcare was close to my heart. I had done a lot of work in healthcare professionally. And I'm a type 1 diabetic, which is a childhood form of diabetes. So just personally and professionally, I connected with the sector very well. And I thought it would be useful to start in this place. We didn't know what exactly would our business model be. We had a few ideas, we got started with it, but it evolved significantly over the years.
Nice. I like Frank's story. I think there's a lot of drama associated around starting like a pivotal event, a lot of things. But I think sometimes it just, like you said, it just could be that I wanted to do something and I did it. But how did you choose this business model? How did you name THP? I'm very curious to hear about that.
No, I think there are two parts to it actually. Just also on your earlier question on is there a pivotal event that happens? Right? The reality of the life is that irrespective of how someone starts, right? Like I started with some reason, and somebody else starts with another reason, and there are some people who are trying to solve their real problems in life. The reality of the life is that as you start to get into it, you realize that whatever your reason is, the reality of running the business is as hard. So what you do is, you actually, the only thing that then motivates you after a while is the fact that you have to make it large. You've taken the plunge now, whatever might have been the reason. Now you just want to prove that you can build the business. And after a while, every entrepreneur only gets motivated by the fact that I want to build a large business. I've jumped into it. I want to build a large business. Yes, some will not work out eventually, but most entrepreneurs will keep going, will just basically want to do it because they want to prove that they can build a large business. So I think that's sort of and specifically on our business model. Also, business model evolved, right? This whole thing on we pivoted, right? We evolved into a new business model is real. Sometimes it's subtle, sometimes it's very evident, sometimes you can fundamentally change your business from one thing to the other. But sometimes it's subtle, but the subtle evolution will always happen. A subtle evolution will happen. In our case, we actually started with the philosophy that we'll make the billion people healthy. So THB really stood for the healthy billion. And we said we'll make the billion people healthy, but then we got into a name conflict, into a legal tussle with someone who had similar name. And then we just gave up the name and we said, what's in the name, right? So let's just build the business. Let's not worry about the name. And then we continued with the acronym THP because that's what our website was as well. and we said we'll just create some new full form for it, right? So, and then the THP after a while stood for Technology, Healthcare, Big Data Analytics. And it's just, really, if somebody asks me what the full form is, we end up telling them it's Technology, Healthcare, Big Data Analytics. But it's really, the focus is build the business, right? What's in the name? The name will happen. So I think that's how we started THB, and that's how the name was carved out. The first 2 years were very exploratory. I'll be honest. We raised money, but I also think that the money was raised to actually experiment more than build. And most of the work in the first 2 years, we tried multiple things. We started with an EMR system. We said we'll give EMR to doctors, data will get created, and we could do things with that data. We started a platform where patients could upload their records. We said data will get created and we'll do something with it, right? We tried a lot of business models in the first couple of years. There was a time, and I don't think I've ever spoken about that in a public forum, but there was also a time when at one point we were thinking, should we just get into this whole sort of space of health and nutrition and do something in organic and combine that with the health data sets. We tried all kind of things, right? In the first 2 years, everything happened. And then I think, you're always looking for that one thing that will hopefully scale up, right? And then there was this one sort of partner we used to work with who had access to, his own data sets of about 10 lakh patients. And he offered to give us that data. And he said, why don't you take this data and let's do something with it, right? And that was sort of really the starting point. And we said, yes, I think if there's already data out there, why are we trying to create our own data on whether it's through patients, through doctors, etc. Let's just go to people who already have data sets and work, collaborate. Let's use a collaborative model rather than trying to create our own asset, etc., etc. And then we started collaborating with people to kind of create value from the data sets, and that's how the story kind of really evolved.
Interesting. So Akansh, where are you today in that journey? What is the data that you have? What is the business model? How do you see that growing in the future?
So the first thing I always tell everyone is, what is the data you have is not the right question. What is the data your partners have? Because I'm really a collaborator, right? I'm in that classic sort of model. I'm just sort of working with people who have data and working with them, collaborating with them to create value. I don't have my own data. I'm licensing data from them and working with them to create value out of it. So where we are in the journey, I think we have some very, very deep relationships. We have a good sort of doctor network who works with us. We have a good set of hospitals who work with us. We have some good diagnostic chains who work with us. And the use cases have evolved. We started off saying, let's do research, and RWE was one of the popular use cases. But the use cases have evolved. We do about 4-5 things today. Many of them are available on our website today. But the idea has always been saying, there's a lot of data out there. Most of it is not in a meaningful structure and format. Let's make it meaningful. Let's create value of it and pursue a set of sort of use cases where people could generate value for themselves. So that's sort of, and as I said, RWA is one part of the couple of things that we do.
One challenge I have particularly seen working in this area is it's very hard to convince hospitals or other partners to license their data. And there are various issues around trust, the degree of digitization of their data, etc. How have you dealt with those over time to make them comfortable with licensing data to you, seeing value in that entire journey?
Yeah, I'll give you a couple of analogs, right? When OYO started, one of my biggest antithesis was that why would a hotel let you rebrand under the umbrella of OYO? Like it's his hotel, it's his brand. Why would he just give it to you and say that, just run my hotel? And lots of these are run by promoters, right? That's their living. That's what they do. And why would they suddenly just change the brand name and say now it's a OYO hotel? Similarly, if you think about it, right? Why would Make My Trip get integrated with an airline? Like why would let's say a Vistara or a Deccan back then, or a Kingfisher and Jet Airways and others say, okay, we'll make ourselves available on Make My Trip and you could actually do booking for us, right? Like people have to fly, they'll go to Kingfisher, they'll go to Jet Airways, book the ticket. So I think in the world, we sometimes we sometimes underestimate the power of a compelling proposition. And we always kind of hesitate saying that why would somebody work with you? But the reality of the life is every CEO in the world, every owner in the world, every promoter in the world would would talk to you for a compelling proposition, right? So if you have a compelling proposition, whether it's about data, whether it's about listing them on your platform, whether it's about rebranding them, it does not matter. The reality of the life is if there's a compelling proposition on the table, people will talk to you. Yes, your agreements may vary, right? One partner may have different priorities, the other partner may have different priorities, and so on and so forth. But people will talk to you if you have a clear proposition to add value in their lives.
Got it. Got it. No, that's interesting. You say that because a lot of companies shy away from this particular piece. And how do you license data? It sounds hard, but I think you're right. If you have the compelling value proposition and if you persist enough, you get access to them. So, Akansh, now moving on to the next question I had, which was like, you guys license data. RW is one of the use cases. I'm sure there are others in terms of research, studies, etc. What is the state of data maturity in India today in healthcare? And maybe you can say in absolute terms or in relative terms to other markets. And how do you see it moving forward in next 5-10 years?
The good thing is it's only going up. When the data is in a pathetic state, it only means it can get better, right? Like that's the reality of life. So I think the macro indicators are great. COVID has helped accelerate digitalization. A lot of doctors have started adopting, writing prescriptions online and so on and so forth, right? So data is getting generated and in a slightly more better fashion than it was few years ago. So I think the macro factor is great. I don't think we even need to talk about it. Everyone understands it's logical. Everyone knows it's only going to get better. I think the even in the current state of how data is, the data is India is at least the country which is our home market where we started building our business. The advantage of this country is that we always talk in crores. We never talk in thousands or hundreds, right? Like we always talk in crores, and I think that's the advantage of the country. I'll tell you about a particular use case that we were trying to solve, where we wanted to prove that one medicine is better than the other, and the indication was diarrhea in children. In diarrhea in children, one medication is better than the other. Now the catch with this use case is that you have to have at least 3 or 4 visits of the child to actually prove whether the medicine was effective or not. And the problem in the context of not just India or any other country, right? Once the diarrhea is improved, nobody would come back, right? And tell you now it's improved, right? So you actually don't know when it's improved. Like after the first visit, most people would not come back, right? So, yeah. But the advantage that we were playing with was we were operating in very, very high quantum of patient data, right? So we said, okay, let's apply a filter. Let's apply a filter. Take off everyone who does not have more than one visit. Then we said, okay, now within this thousands of patients, let's take off everyone who does not have minimum number of parameters required. Now within these thousands of patients, let's take everyone who does not have age criteria and the gender criteria that's meeting, and the prescribed medication criteria. After doing everything, we were still left with hundreds of patients. And we said, okay, ठीक है, अभी hundreds of patients के साथ काम हो जाएगा, कोई दिक्कत नहीं है. The reality of the life is that in a context like India, it does not matter how pathetic the data is, right? You're always playing in crores. And then crores comes to lakhs, comes to thousands, to hundreds, you will still get your answer. So I think that's the benefit. And it will only hopefully get better. The research that we do in hundreds of patients today, hopefully we'll start doing in lakhs of patients tomorrow, right? If the data quality improves. But there's always a use case you can address.
So on data quality, Akansh, like, are there initiatives actually in play in India in terms of improving data quality, both in terms of standardization or using standard ontologies which are used globally? Are there initiatives? Is that happening on the ground as you interact with hospitals?
See, the private hospitals and private institutes won't really have any incentive to do it, right? Like, why would they want to do it? And that's additional cost. At the end of the day, anything that you want to do is additional cost. Yes, government has few initiatives, NDHM, One Unified ID, iSpirits protocols, etc., etc. They're all in that direction of can we standardize and organize the data sets. And we'll see, right? Some of that gets implemented, life will improve, and so on and so forth. But there are only two things that work in life: carrot and stick. There is no stick right now for any healthcare provider to organize it. You can create some carrots and do it. We create the carrots. We try and work with healthcare providers to show them the value, and therefore they work with us to organize some of that data sets. So I think that's life. We'll see. My sense is, in time to come, in years to come, there may be directives from the government that make people organize the data and accelerate this path of organizing the data better. But to be honest, it's a problem across the world, right? Nobody wants interoperability. Everyone wants to keep their own data, and so on and so forth, right? Either insurance penetration will go up, people would want to standardize, to make sure they fit into that framework, or government would come with a directive. We'll see. It's not a priority path right now. You could do that in pockets if you create, reasons for people to organize the data.
I have seen in other markets, right, there are a few incentives which have worked. One is the government, right? Government could be carrot or stick. The same could be insurers playing that role. Third could be investors playing that role, like private equity or any investors, as they start consolidating, they could bring in this change. And then pharma with their research budgets could bring in that. But the question I had for you is, are the research budgets or investments large enough where this could happen, or still they're not large enough where there are incentives for people to start improving their data?
I think the articulation is slightly different. Are the budgets large enough? It is always shades of gray, right? A 1,000 crore brand will always have large enough budget. A 10 crore brand will never have a large enough budget. So I don't think the answer is universal, right? The answer is in pockets. Yes, XYZ has a budget because it's a very large brand, or it's because it has a very large sort of room for growth. They will invest money to do whatever it will take to grow it, right? So I think the answer is in pockets. I don't think it's a large enough budget or a small enough budget, right? It's in pockets. And that's how life works. It's shades of gray, in pockets. People, you just have to find out where those, opportunities are.
But that is encouraging what you said, that at least in pockets, there are those budgets, because that's where it starts. If those also did not exist, then probably it would be very discouraging. But if there are budgets in pockets, others will see it, get inspiration from it, and then eventually prioritize it.
Absolutely. And it's not just pockets of private budgets, right? It's also, there are these global grants that come in from time to time. They're trying to build registry programs, etc. They're all working towards certain causes, right? So in pockets, there will always be opportunity, right? Now you need to find out where your pocket of opportunity is and pursue it. And that's what the business building is all about. You keep identifying where your opportunities are.
So speaking of opportunities and identifying them, Akash, you have had a long career in healthcare now, at least relatively speaking. What are some of the challenges you commonly saw? What are the things that you would want to advise people who would want to build a career in healthcare, innovate in healthcare, and even some of them start on their own in healthcare? What would be your advice? What are some of the challenges you have faced? And from that, what could you convey as a learning?
Yeah, I think there are lots of things that can go wrong in any business, right? I think there are two or three things that I would say, and I'm thinking very sort of analytics, data businesses, B2B, not B2C, etc. Right? I think a couple of things I would say is it's not a business that can be run by one or two people or one or two skill sets, right? Like it requires multiple skill sets. So especially in healthcare, you need the medical expertise, you also need the analytical expertise, you also need the engineering expertise, you also need the relationship building and convincing somebody with a compelling proposition expertise. It is so the one thing that I would definitely say is anyone who's starting up has to make sure they have all the areas covered, right? Like they're not getting into a situation where they don't know one aspect of the business or not comfortable in one aspect of the business. So I'd say it's a complicated business, right? And building that sort of integrated team with multiple skill sets, etc., is actually an important part of this business. And you know how it is, right? Right now, team building and hiring and attrition are some of the biggest challenges that everyone is facing. And I'm assuming these will only, get even deeper challenges as we move along, right? It's not going to get solved. It's not like the way innovation is progressing and the way capital is being invested, the talent is not maturing at the same pace, right? And therefore this challenge will continue to remain. I think the second big thing is, given this is not a, it's not one of the B2C push your marketing, push your budgets, get customer acquisitions, etc., right? I think, it's important to kind of stay lean till the point you find your, magic wand. And then when you can find your magic wand, then go after it, push it, make sure the economics are tight, etc., etc. So I think those are the two things that I'd say.
Got it. And when you talk about skills, right? Like, are there any skills that people can prepare themselves with ahead of starting, like any technical or business skills that you think will make a difference?
See, the skill sets required will also vary, right? Like, if you're trying to build let's say a real world evidence business, you would want skills like biostatistics, health economics, and things of that nature. If you're doing, let's say, big data models, you would not need big data analytics as a skill set. Sometimes people just do visualization dashboards. That's a skill set. It can be easily sort of picked up. Sometimes data management is a solution. You need engineering skill sets. I think this, the reality is it really depends on the final use case and the final business that you're building. I would say it's harder to pick up medical expertise. You can't become a doctor overnight. So things of that nature are difficult. It's harder to pick up engineering skills. Things of that nature are difficult. I think analytics is something that people can pick up over a period of time, at least basic analytics, visualization, running SQL queries, Python, etc. These are still slightly easier sort of skill sets. I wouldn't sort of undermine the talent that people bring in this area, but you could get smarter about it. Like, it's harder to become a doctor overnight. It's harder to start coding overnight, but you could still invest your time in being a better analyst. I think, just very loosely said.
No, I agree. I think it's also hard to, like, not just medical. It's hard to be a coder overnight. I've been taking Python classes and it's hard. I don't think you can learn it overnight.
And it also doesn't come naturally. It also doesn't come naturally to everyone, right? Like, I think you need a very sort of different mindset. I went to a computer science engineering college, and I was probably one of the, I'm going to loosely say this, one of the bottom quartile guys, right? But that didn't mean I was stupid, right? I didn't have that knack of coding. I didn't have that geekiness in me to kind of be a great coder, right? That wasn't me. So I had a very good friend of mine who used to be a very, very smart coder. And I used to be a very, very smart presenter, right? So, and I would tag team with him. He's still my co-founder, so I've always tag team with him. He's the guy who does the work. It comes naturally to him, and this comes naturally to me, right? So,
that's awesome.
So not everyone's a born coder, by the way. Or so let's see. That's how life moves on.
But that's good. I think what you mentioned, right? Building that right team. I think that, and not knowing that what you are not good at, so you then solve for it by finding the right co-founders or team. So Akansh, now based on your view of the market, are there any specific opportunity areas that you think which are kind of ripe for the taking, which new aspirants can look at as they think of starting on their own or innovating within large companies? And I'm sure if there are, you would also want to be taking on those, but still at a high level.
No, on a lighter note, if I tell you, I'll have to kill you. But no, I'll be honest. There's so much of white space. There's so much of white space. Really, you could work in any direction right now in healthcare data. There will be an opportunity that will get created. Not just in, people think maybe US is the only market where most of the healthcare dollar goes in, right? It's everywhere. The opportunities, opportunity exists in all parts of the world. Healthcare data is getting created at a much faster pace than it is getting used. And as far as there is more supply of data than the use cases that have matured, there will always be opportunity, right? You could go in any direction. Really, you could as simple as people just don't even have good MIS dashboards, right? And I'm not saying everything will become a $1 billion business, but it does not matter, right? I'm saying opportunity exists everywhere, and you could start small and you could grow and scale and find more use cases, etc. Really, I was working with a customer who had a RCM, revenue cycle management analytics dashboard that he was used to monitoring it, right? And he would monitor his insurance receivables using that. The dashboard that he was using did not include all the insurance companies. He had $1 million. He did not know he had to get collected, right? Like, I'm saying things are broken at that level, right? So that's an opportunity, right? If you find someone $1 million, why would he not pay you? He would pay you. So I'm saying it's as basic as that, right? Like, so there are opportunities in healthcare data. The supply of data is getting much faster generated. People are doing voice to text, people are doing writing to text, people are doing, text to structured, people are doing all kinds of things, right? So more data is getting created. And as far as, more data is getting created, the use cases and the demand of value generation will keep rising. You just have to know where to operate, how large you want to become. Is this large enough and exciting enough for you, for your investors, for your board? Find the next big thing, look at the next big market. It's a journey. You just have to keep traveling.
Got it, Akansh. Thanks for sharing these insights. Akansh, any final words for our audience before parting?
No, I think, Purav, you're doing this is great. We're all, this is creating data, right? We're creating data, content. This is what our lives are centered around now. So, the only thing that it says, and this is not healthcare data specifically, right? I just feel like in anyone's lifetime, building a business, running a business, it doesn't matter. You do it for 5 years, you do it for 10, you do it for 100 years, right? It does not matter. I think it's just an exciting journey to be a part of. And if in that journey you're able to make it a large business, the cliched unicorn definition, I think it makes it even more exciting. But I think building a business is just an exciting journey, and everyone should at least attempt it once.
That's very well said, and I firmly believe in it. Everyone should attempt it once. It's very satisfying and worth the pain. So thanks so much, Akansh, for sharing time.
No, thank you for having me over.
All the insights. Thank you.